So good afternoon. Last year in King County, 2,575 people died from heart disease. Another 728 from lung cancer, 695 from stroke, and over 300 from diabetes. These four causes of death account for over 40% of all deaths in our county each year. To share about making a difference. This morning, as you've heard, Secretary Sebelius announced that Public Health South King County is being awarded $25.5 million over the next 2 years to begin to start programs to prevent these chronic diseases from occurring and to prevent people from dying from them. We're going to immediately make this money available to our community to implement proven, known methods for attacking the underlying risk factors. We know what works, we know what to do. The job is now to do this in an innovative way locally. In particular, these grants are going to allow us to attack issues like improving nutrition, increasing physical activity, reducing exposure to tobacco and tobacco use, the leading underlying risk factors for heart disease, strokes, and other chronic diseases that are killing us. The primary goal of these grants is actually to make the healthy choices that people want to make the easy choice for them to make. Examples of kinds of things that the grants are going to support would include working with corner grocery stores to increase healthy options that they're selling, working with schools and daycares to increase healthy foods in those settings, restricting tobacco marketing to our kids and providing smoke-free environments more broadly, promoting city planning, zoning and transportation for safe walking and biking trails. This money is going to go out to our community primarily through grants to schools, to community-based organizations, and to governments. And because King County has very significant health disparities between our affluent and our poor populations, between our white population and our communities of color, we're specifically targeting much of this money for our most disadvantaged communities. And finally, since these are federal stimulus dollars, it's worth making the point that this is $25 million that's going out to create jobs to help in our economic recovery. A part of this financing is going to create a new low-interest loan program for community businesses that want to implement healthier practices. And finally, to recognize that combined tobacco and obesity cost this county almost $750 million every year. And so to the extent we are effective, and we are going to be effective, we will be saving not only lives, but improving the economy of our region as well. That concludes the opening comments that I wanted to make, and Dr. Jim Krieger, who is the head of our chronic disease unit here, and I would be happy to answer any questions that you might have.
Was there an application for this? How did this come about?
So this was part of the federal stimulus package that was passed last year, and within that, there were monies available to Health and Human Services to provide to communities. That money decision was made to let that out in a competitive fashion, and so there was a competitive granting process with an application that we developed. There were about 600 letters of intent and over 250 applications that were received nationally. 44 communities today were awarded funds based on the applications they submitted.
Do you have any benchmark targets for outcomes, goals?
Jim?
I think we have to recognize that there's a 2-year funding period because it's stimulus funding, and so it's not a very long period of time. So our targets are more focused on creating changes that are measurable in our community and that promote health. So these could be a number of new policies that are adopted by schools or childcare to promote healthy eating and active living. It could be policies adopted by local government to promote access to healthy foods. So we're looking at those as the real products and outcomes to measure for this grant. And we know because of the scientific evidence, because these are proven interventions, that they will ultimately result in improved health outcomes and changes in behavior in King County. And to the extent that we're able to track these, we will monitor for years after this 2-year funding period goes to look at the impact of what this application will let us do.
So what sort of program might my kids see in their schools?
There are a number of things that we would encourage schools to apply to do. One would be, for example, to improve the quality of food served in the schools. So improving the quality of both school meals, but also looking at the competitive foods, meaning those that are not part of the school meal program, and how the nutritional quality of those could be enhanced. Other things kids might see in their schools could be improving opportunities for physical activity. So we would encourage schools, for example, to adopt recess before lunch, particularly in elementary school. We would adopt them to, or encourage them to adopt standard and high-quality physical education programs and make sure kids are getting an adequate number of minutes per week in active physical education and physical activity.
In that situation, how do you actually spend the money? Do you hire a consultant to come into the school, or a nutritionist, or physical education?
So it's a very important question, and a very important element of this grant is that we're really looking to the community to say, what are the policies and programs that you want to put in place? Tell us what that is, cost out how much it's going to take to make that change, and then we will provide you with the financing to do this. This is community driven, and rather than us saying, here's what you should be doing, we're giving people a broad menu of choices and letting the community say, this is what we want to make happen, and this is what it's going to cost.
So do entities around the community have an application process to you guys now?
Yes, that's correct. And talk a little bit about the
Yeah, so
particulars.
what we'll be doing is we'll be soliciting applications from the sectors that we've focused on in this work, namely schools, communities, local governments, and the business sector. And we will be offering them RFPs, or requests for proposals, where they can propose and select which of the strategies they would like to try out and implement in their particular institutions or communities, and what activities they'll do then to actually put them into practice. And as Dr. Fleming said, the types of activities that they will choose will be based on their assessment of the local circumstances and what will work best in their context and in their setting, as long as they're consistent with what we know are effective and good practices.
What sort of thing could a small business come to you with an idea, and what sort of programs? They may not have thought of anything. What would be sort of in the ballpark? What's been shown to work or
So
work
small
elsewhere?
businesses certainly can come, and in addition, independent of this granting process we talked about, some of this money is going to be used to actually create a low-interest loan program that businesses can apply for low-interest loans. A classic example would be, we know that particularly in some of our inner city and South King County urban areas, that fresh produce and healthy foods are not part of what's available in many corner markets. In part, that may be because, for example, fresh produce requires refrigeration and special display. This money could be used by a store that was interested in beginning to stock fresh produce to get the capital it would need to install the equipment that would be needed to provide that in a safe and nutritious way.
A couple other examples could be the growing interest in what's called mobile vending, so the little food trucks that go around. There could be loans made to help support small businesses develop food trucks that serve healthy foods rather than less healthy foods. Another example is there are a number of companies that stock vending machines, and some of them have already approached us saying, we'd like to expand so we can do more healthy vending items and have more capacity to stock vending machines with healthier food items.
Anything else? Thank you very much.
Okay, great.
Great.